If you look down at your sofa and you can see the imprint of your buttocks, there's a problem. Excessive sitting, whether it's at home, at work, when you mush it all together, is associated now with the recent medical findings with a whole slew of concerns from a health perspective. The first is obvious. If somebody is sitting for too long throughout their day, they're not burning calories. The data suggests that people on the whole are eating about the same as they did a couple of hundred years ago, but by sitting too long, they're burning too few calories, and so obesity is the consequence. So when we think about the health consequences of excess sitting, it is obesity, the metabolic diseases such as diabetes, hypertension, high cholesterol.
Hi, my name is Gabbie, and my presentation is going to be on sitting versus active workstations. So to outline my presentation, we're going to be talking about the definition of sedentary behavior, risk factors of sedentary behavior, physiological risk factors of cardiovascular disease, and studies on sitting versus active workstations. Sedentary behavior, as defined by the Merriam-Webster Dictionary, is doing or involving a lot of sitting or not doing physical activity. So many forms of sedentary behavior involve sitting, such as sitting in class while listening to lectures, driving in your car, eating meals, watching TV, or sitting at a desk to work. So risk of sedentary behavior. There are studies out there that show that there's a positive correlation between sitting and mortality rates from all causes and in cardiovascular disease. So sitting also has risks involving metabolic processes such as cholesterol, resting blood pressure, fasting plasma glucose, and triglycerides. Cardiovascular risk factors have two different categories. So there's unmodifiable risk factors and modifiable risk factors. So some of the unmodifiable risk factors are family history, age, gender, ethnicity, and these are risk factors that we can't really change. Modifiable risk factors are things that we can change to a certain extent, such as blood pressure, resting heart rate, blood glucose levels, and physical inactivity. So I want to take some time to talk about blood pressure. What is blood pressure? Blood pressure is the two forces that occur in your heart. So the first is blood pumping out of your heart into your arteries, and the second is the rest between each heartbeat. So systolic blood pressure over diastolic blood pressure. So blood pressure is measured within your arteries. So arteries are muscles that have semi-flexible tissue that stretches to allow blood flow to the body. So why is high blood pressure a cardiovascular risk factor? Because if pressure in the arteries is too high over a long period of time, this can damage the arterial walls, which causes an inflammatory response, which then causes vascular weakness, scar tissue, which then increases plaque buildup. And this all increases the workload of your circulatory system and your heart, which is a high risk factor for cardiovascular disease. Resting heart rate. So what is heart rate? Heart rate is the number of beats per unit of time. So we measure heart rate by beats per minute. And with each beat, the heart pumps an amount of blood to your blood vessels. So as the blood flows through your arterial wall, it expands, and that's the pulse that you feel when you're measuring heart rate. So at rest, a normal heart rate should not exceed 100 beats per minute, because at rest your heart should not be working hard to pump blood through your vessels while you're not engaged in physical activity. So at rest, if your heart rate is high, you're putting stress on your heart and increased workload throughout your circulatory system, which could put you at risk for cardiovascular disease. what is blood glucose? Blood glucose is exactly what it says it is. It's glucose within the blood. So why is an increased level of blood glucose a cardiovascular risk factor? Is because when there's a high level of glucose within your blood, that means there's an impaired insulin release. So when there are high concentrations of glucose within the blood, that means there are lower levels of other substrates within your blood. And over a prolonged period of high glucose levels within the blood inhibits the blood vessels to dilate or relax. So the lower substrates within your blood would, for example, would be like nitric oxide, which is a vasodilator. So without dilation, without these enzymes within your blood to cause dilation, your blood pressure will go up in order to get the blood through your blood vessels, and then this causes inflammatory effects of blood pressure. So there has been past research studies done on glucose intolerance and its effects on cardiovascular disease. And this longitudinal study done by Barr et al., they looked at 1,428 participants, and after a follow-up period, they found that 298 deaths occurred, and 65% of those deaths were by cardiovascular disease. And each individual within that 65% had known diabetes, newly diagnosed diabetes, impaired glucose tolerance, and impaired fasting glucose at baseline. Therefore, there was a correlation between glucose intolerance and cardiovascular disease. Cardiovascular risk factors and sitting. So how do they relate? So I talked about how there were studies done that showed positive correlation between sitting, the amount of time sitting, and mortality rates. And I just talked about different risk factors. And because sitting is defined as a sedentary behavior increases your risks for getting high blood pressure, high blood glucose, and increased resting heart rate. Therefore, it affects your cardiovascular system and increases your risk for CVD. So why sitting? Is because there are numerous studies done on increasing physical activity to decrease the risk factors of CVD, where there are now starting to have more studies on decreasing the amount of sitting plus physical activity. So I just want to define what active workstations are before talking about the different studies that compared sitting to active workstations. So the definition of active workstation that I'm going to use is any act of breaking up sitting or not sitting at all. So it doesn't have to be a treadmill desk or a cycling desk. It could be just standing up from where you're sitting, walking around, or doing stretches. So the first study that I would like to talk about is done where they compared vigorous physical activity, light to moderate physical activity, and sitting, and its effects on the metabolic outcomes of sedentary behavior. So the purpose of this study was to test the hypothesis that 1 hour of physical activity does not compensate for the negative effects of metabolic outcomes due to sedentary behavior. So in this study, they had 18 subjects, and 17 were females, 3 were males, and they did some baseline measurements and then put them through 3 randomized experimental regimens. So the first one was sitting. So the sitting regimen consists of 14 hours of sitting, 1 hour of walking, 1 hour of standing, and 8 hours of sleep, or in the supine position. And then the next regimen was exercise. So the exercise one was like the sitting regimen, except they replaced 1 hour of sitting with 1 hour of supervised vigorous cycling. And then there was the light to moderate physical activity regimen, and that was replacing 6 hours of sitting with 4 hours of walking at a leisure pace, 2 hours of standing, and each of these regimens were performed over 4 days with 10 days of a washout period between each regimen. So this was all monitored using an active PAL and journal to monitor physical activity and nutritional food intake. So the results showed that there were more benefits from the light to moderate physical activity regimen from walking or standing with a combination of a decreased time spent sitting. The next study examined breaks in sedentary behavior and its effects on different measurements, such as blood lipid, blood pressure, glucose measurements, and other objective assessments. And there were 168 participants, and the methods that were used were they did various assessment measurements for anthropometric, biochemical, and behavior assessments. They also did a glucose tolerance test, a fasting 2-hour plasma glucose, triglycerides, and HDL cholesterol levels. And then they used an accelerometer to measure physical activity, and they were instructed to use them during the waking hours for 7 days, as well as keep an activity journal. So this measured their activity within the day, basically whether or not they were sitting, and then it measured when they would stand up or take a break from sitting. So in conclusion, the number of breaks in sedentary behavior was associated with a lower waist circumference, a BMI, triglycerides, and a lower 2-hour plasma glucose measurement. So the next study was done on a 1-year intervention of treadmill desks in an office setting. So the purpose of this research was to increase employee daily physical activity and decrease daily sedentary time. So they did this by they had 36 volunteer subjects and who worked at a desk, and what they did was they made a standing desk that could go over a treadmill, and this was done over a year, and they took baseline measurements, and then they did measurements at 6 months and then 12 months, and they did this with weight, body comp, glucose, hemoglobin, total cholesterol, triglycerides, waist circumference, blood pressure, and they took physical activity observations. So during the 12 months, they replaced their desk with a treadmill desk, and they had to wear a belt accelerometer, which measured their physical activity. So the physical activity at baseline averaged 3,353 activity units a day, and then at 6 months, after 6-month intervention, it increased about 1,000 activity units, and then it stayed there after 12 months intervention. And then for decreased sedentary time, at baseline it was about 1,000 minutes a day, and then it decreased 100 minutes for the next 6 to 12 months. So in conclusion, treadmill desks increase physical activity and decreases daily sitting activity, and this also decreased cardiovascular risk factors such as weight, body fat percentage, glucose, triglycerides, cholesterol, and blood pressure. And in conclusion, access to these treadmill desks may improve the health in office workers. So my last research that I want to talk about is it was done on walking and working, and to examine if vertical workstations increase energy expenditure compared to sitting. So they took 15 healthy sedentary obese subjects. So 14 were females, 1 was a male, and they measured energy expenditure in different positions. So one was a lying position, motionless, sitting and working at a desk, standing motionless, walking, standing with desk set up and working, so standing and working at a desk, and then walking at a self-selected speed on a treadmill and working. So the results were that the mean increase in energy expenditure for walking and working over sitting was 119 kilocalories per hour. So in conclusion, sitting time replaced with walking and working can increase your energy expenditure by about 100 kilocalories an hour. And this could potentially help obese individuals if they were to replace 2 to 3 hours of sitting, and if they kept all their other energy expenditures constant, they could lose up to about 10 to 13 pounds a year, which can then help decrease various risk factors for cardiovascular disease. So in conclusion, we should reduce time spent sitting in addition to maintaining or increasing physical activity. So some real-world applications for sitting versus active workstations is that in your daily lives of working, if you work at a desk, maybe take breaks throughout your day by setting a 30-minute timer, or just reminding yourself to get up and take a break by walking around your office. You can walk to get a drink of water, walk to say hi to a friend across the hall. Just breaking up that sitting. It doesn't have to be with physical activity, just simply walking around your office space. And then for a personal trainer or in a clinical setting, this could be really helpful, because if you are working with sedentary individuals, you could ask them how much time they've spent sitting, talk about ways to reduce that time, and then they could possibly get a better outcome with their training regimens or intervention in the clinical setting. And here are my